Hey, you guys, welcome back. Sky Houston here. And today we're going to have what I like to call an extended conversation about a topic we talked about in November. Many of you know that November was National Caregivers Month. Now that we're past that, we're going to have a special guest today here from our friends over at Aetna talking about Black Health 365 because a lot of these concerns go well past the national recognized months. So before I get started, I just want to go ahead and bring my guest in to talk about this topic on today. Now, a lot of us know the backbone of our healthcare systems are our nurses, our doctors, our hospitals. But there's another unsung hero that I want to talk about on today, and that's our caregivers. So if you would, with me, welcome in to the conversation today, Amy Bosenhart. She's representing Aetna Black Health 365. Welcome, Amy. Hi.
Hi, Sky. How are you?
I'm wonderful. And we were talking a little bit before you came on, and I heard that you're a nurse. Would you give us a little bit of your background? And then let's just jump into this wonderful topic on caregivers.
Sure. So I started nursing probably when I was 2, when I had a toy poodle and I would mummify this poor thing in gauze wrap, right? So I kind of always knew my whole life where I was going. So I started my career as a nurse's aide as a teenager and kind of went through the whole process. I did the LPN track. I did an associate's degree, a bachelor's degree, finally ending up with my master's degree a little bit later in life. But yeah, so my trade and training part of nursing, now I've been a nurse for a long time, mind you, about 35 years now, is oncology. So I spent the bulk of my bedside years in oncology.
Nice. Now, I love the fact that you were a 2-year-old nurse. They say once you know who you are, go strong, fast, and hard in that direction. So we're pleased to have
Yeah.
you and your expertise since the age of 2 here. But no, seriously, we're really happy that you're here to extend this conversation on caregiving. Last month, or November, the month of November was not only National Family Caregivers Month, it was also Alzheimer's Month. Can you tell us a little bit about where we stand in that regard, just in the U.S. in general?
Sure. So when we think about Alzheimer's, so in the United States, we have over 7 million adults over the age of 65 that have Alzheimer's disease. That's pretty
Wow.
significant.
Say
That's
that number
roughly
again, Amy.
Pardon?
Say that number again. That's a tremendous number.
Well, there's 7 million adults over the age of 65 that are today living with Alzheimer's disease in the US,
Wow.
right? That's about 1 in 9 seniors. And
Wow.
when we think about Alzheimer's prevalence, that's expected to grow from 7 million today to roughly 14 million by 2060. So just about doubling in 30 years.
Wow.
That's a big change.
It's a huge change. And it immediately had me think about who's caring for that millions and millions of elderly individuals who are going through Alzheimer's. And I immediately thought about myself, not to be selfish, but I identify with my mom aging. And at the same time, I realized I have a child. So as we keep progressing with this number, can we talk about that middle person that I know they call it the sandwich generation that's in the
They
middle
do.
and going to be taking care of those who have Alzheimer's? Give us a
They
little more
do.
definition about that sandwich generation and what challenges do they face?
So I'm going to just talk about Alzheimer's for just a second. When we talk about people that are caring for Alzheimer's, right? There's 12 million caregivers taking care of people with Alzheimer's and dementia today. So they provide roughly 19 billion hours of unpaid care. In 2024 dollars, that comes out to roughly $413 billion. That, if you think about it in terms of the GDP, is more than many small to mid-sized countries. So it's a lot, right? And mostly those are unseen caregivers. And yes, they're the sandwich generation. Those are the folks that have parents who are aging or are elderly, and they're dealing also with their children who are growing. So you have both ends of the spectrum, and you're kind of that little candle that's left in the middle trying to keep both ends burning. It's tough. It's very difficult. And I understand, you've got mom who's aging and you're thinking about that. I will share, I've got some personal experience with Alzheimer's. My mom had Alzheimer's disease. She passed away about 2 years ago.
Oh, I'm sorry to
And
hear.
I spent probably 10 to 15 years caring for her before she passed away. So
Wow.
it's significant. Yeah, it's significant, right? So when you think about that, you have those folks, 29% roughly of caregivers in the US are part of that sandwich generation. And when we think about those that are under 50 years old, like yourself, that really increases to about 47%. And about half of all caregivers that are taking care of people with dementias report that impact to personal finances and to mental health. There's a toll that's to be paid for caregiving. So
Yeah.
when your parents need that kind of care, oftentimes they're on a fixed income and their care needs will exceed what they have available to them. So that falls to their children to fill in that gap, especially with the cost of healthcare today.
Mhm.
So on the other end of that spectrum, you're trying to manage your young and growing family and children along with
Yeah.
your own life. So you're really kind of caring for three age groups all at the same time, including yourself. And unfortunately, sometimes yourself falls last in the pack, right?
Yeah.
We fall to the bottom of the barrel. So when we look at caregivers who are in that sandwich space, caring for both their elderly parents and their young children or their growing families, we have caregivers that experience significant stress. 40 to 70% will show clinically significant symptoms of depression, and up to half of those meet criteria for a major depressive disorder at some point during their caregiving journey. So it really does have an impact on everyone involved.
Absolutely. I hear you say stress. I immediately begin to think about burnout. I think about, do you even recognize when you're part of that sandwich generation, if you even recognize what's happening to you, because you don't have that luxury of stopping down and say, where am I? How am I? Taking stock of yourself. So I can just imagine many challenges, even those that we don't talk about or we haven't just named. So real quick, if you're in the chat and you can identify with this, or if you're listening to us on the podcast and can identify with this, leave us a comment. Let us know what are some of the things that you're facing if you are a part of that sandwich generation, maybe that we didn't say. Would love to hear from you as this interview is going on. Now, Amy, how can we support caregivers, especially those who are caring for someone with Alzheimer's disease? Because that's a whole nother level of caregiving.
So it really is. And, when you think about it, think about those folks that you may or may not know that are caring for an elderly parent that, you used to go out to the movies once a month and now they can't make it anymore. Or maybe you had a dinner that a group of friends would go to and they just aren't showing up anymore. Continue to reach out to those people because they really do need that sort of draw them back into that social circle because those impacts are real. But there are other support systems that are available to folks as well. So you think about things like long-term care insurance, right?
Right.
This can help with the financial burdens of long-term care because again, care is super expensive. Paid family leave. Check with your employer. See if that's something that's offered. Sometimes it is, sometimes it isn't. It depends on what state you're in and what companies you're working for. But paid family leave is a real benefit if it's available to you to certainly take advantage of that. There's veterans benefits. Go ahead.
No, I was just going to say thank you for saying that, because that may release somebody who doesn't think or didn't even know that their employer allows that,
Right.
and who wouldn't release themselves to even go after it. I'm going to say right there, the resources are there. Take advantage of them if you can, and if you need them, give yourself that. But go ahead.
Right. Give yourself the grace and have no shame. You
Yeah.
know, take advantage of these things that are available to you because you have to take care of yourself if you're going to continue, because burning the candle at both ends is real. So you have to take care of yourself doing this or you won't be able to do it for long. There is respite care for Alzheimer's support services. There's some adult daycare options. And of course, always, if you have an insurance company that you're working with, reach out to their care management and see if you can get a care manager that can help you. They oftentimes have a lot of resources. They will have social workers, they'll have folks that can help dietitians with maybe there's dietary issues with your loved ones, that they can support you through this journey and they can help you to find resources that maybe you never even thought about. And this, I will say, working in the insurance space, this is a largely underutilized resource. So, be bold and ask for that help.
Why do you think it's underutilized, Amy?
I think part of it is people are shouldering the burden themselves and they don't think to ask and they don't know where to ask or who to ask.
I'm gonna put my hand up in the guilty corner. I'll put my hand up first in the guilty corner. Sometimes we just think we got it or we can do it or we're resilient, but I'll put my hand up first if you're not willing to do it and say we have to get the help. It's available. Thank you again.
You have to. And there's also a 24/7 Alzheimer's helpline, and I'll give you that number. Please. So the number is 272-3900. There's also online support communities that can help you and share that experience of dealing with an Alzheimer's family member. Sometimes you can share tips and tricks with each other that help you to manage some of that care.
Amy, give that number one more time and tell me what that number does when they call that number, what assistance is there?
So it's a helpline and they'll connect you to resources that are available perhaps in your area. The number for the Alzheimer's helpline is 1-800-272-3900.
We're talking caregiver awareness with Amy Bosenhard. Amy, now, how has the research advanced, like the understanding and treatment for Alzheimer's in recent years, or has there been advancement? I can imagine there has been.
Oh, there's been incredible increases in the knowledge base around how to manage Alzheimer's disease. The FDA has really approved some new disease-modifying treatments. They help to target the buildup of the amyloid plaques. The other thing is we have PET scans now that we didn't have historically that can visualize any of those amyloid plaques building up in the brain. And those amyloid plaques are really sort of the hallmarks of helping physicians diagnose Alzheimer's disease. Oftentimes when you think about, geez, my mom might have Alzheimer's or some form of dementia, maybe it's not. Maybe there's something else going on. Could be, maybe a mini stroke. It could be a tumor. It could be stress. It could be a whole host of other things and not really dementia. But until you have that clinical workup and see a provider to help you understand what's happening, that's the best way to get your final on how to manage that. And seeking out that care will also help you get introduced to some of the drugs that may be appropriate for treatment of the Alzheimer's disease, like these new disease modifying ones that are currently available today. We never had these. These are new in the past couple of years. So it's exciting to see some of that research come forward and see some of the impact that that's having on lives.
I was wondering when you gave the numbers earlier, how many people are actually diagnosed, and that number could be bigger for the folks who haven't gotten seen to know if this is really what their loved one is going through. So thank you. Just a reminder, get your loved one seen or tested, take them in if you haven't gotten an official diagnosis. Would be
Sky, that's a really good point. I will share, I had done home care for a very long time, and I know some of those folks that were living at home and quote unquote managing at home, right? They definitely would have been candidates for an Alzheimer's diagnosis. However, they weren't seen, they weren't treated, they weren't addressed for that particular problem. Maybe they were addressed for a cardiac issue or a lung issue, or they fell, but they never had their mental status addressed. And so these people really were at home sort of struggling along by themselves, maybe with one of their kids coming over once in a while to come check on them, maybe having a home care nurse come in and check, but there's now options that historically have not been available.
Wow. Ladies and gentlemen, please, please get your loved one seen, the help they need, the love they need starts with the caregiving that they receive. Now, Amy, what initiatives does CVS Health and Aetna undertake to support individuals who are providing that care? We have a lot of individuals who are just doing it out of the love and the responsibility of being that person. But are there other things, other support options that maybe you know of they can undertake?
There are. So CVS Health and Aetna together are committed to supporting caregivers and addressing those challenges that they face, including the financial strain and mental health impacts.
Mhm.
So that commitment follows findings from the CVS Health and Harris Poll collaboration, which identified about 30% of Americans are caregivers, nearly half of whom are dealing with the financial and mental health stress, right? So Aetna has a resource for living program, and that provides caregivers with access to resources and support, including transportation, financial assistance, basic cleaning skills, and home safety checks. Those are really important. Sometimes folks with Alzheimer's, cleaning isn't something that they're able to do anymore. And then home safety is another issue. You've always had throw rugs in your house, but now, because of the Alzheimer's, it changes the way you are able to walk and move. So sometimes having those throw rugs in the house can actually be a hazard. So getting them out of the way makes a big difference. And that program is really available to the Aetna Medicare Advantage members and their caregivers. We're also looking at expanding the home care services, helping to ease the workload and emotional strain on caregivers. So we offer those support through personalized care management. So we have dedicated care managers to coordinate doctor's appointments or, therapy appointments, to explain treatment plans. Oftentimes somebody will leave their doctor's office with a piece of paper. It's not really helpful if you can't really see it because the print is super small. They're not able to read it anymore. So having that interpretive services of this is what that really means for you and how you can help yourself makes a difference. Manage your medications, making sure that you're not taking two of the same drugs. Oftentimes we get a drug, just as a for instance, you might get Lasix and furosemide. What you don't understand is that those are both the same drug. So if you're taking the two of them, you're actually double dosing yourself. And frequently that is what brings an elder into an emergency room, is they didn't really understand what they were taking and they accidentally overdose themselves.
Wow.
And then of course, communicating with your providers. Yeah. So they have connections to community resources, food assistance, housing support, caregiver support programs. And then there's multidisciplinary support with nurses, social workers, behavioral health, pharmacists, and then, just assistance navigating the care needs that these folks have.
Amy, I feel like this is such great information. We're having the Black Health 365 extended conversation powered by Aetna.